Good morning. My name is Mukesh Haikerwal, and I'm a GP in the western suburbs of Melbourne. I've been involved in advocating for our profession for over 20 years and continue to do that in many different activities that I'm involved in. As you know, I was a former president of the Australian Medical Association. I also work with the Royal Australian College of General Practitioners and also with Australian General Practice Alliance, AGPA, which is looking after the interests of doctors who are owners of general practices. I'm pleased that there is a group of people taking some interest about the issues to hand today. That's the issues of compliance through Medicare, compliance through the systems beyond Medicare, including the Professional Services Review Scheme, and the issues around APRA, the Australian Health Professional Registration Agency, and mandatory reporting. On the last issue first, there was a submission sent by the AMA on Friday and other organisations, and these are very much asking for mandatory reporting for doctors and other health professionals who are registered with APRA to have the mandatory reporting of their illness removed from the scheme. This has been the case in Western Australia that never took that up, and for some reason there is some significant backlash from other states not wanting to change. We know that Minister Hazzard in New South Wales and Minister Hennessy in Victoria are very keen to make that a part of the new scheme, and indeed Federal Health Minister Greg Hunt has also indicated that he sees the need to remove that mandatory reporting legislation and see that as being something that follows the Western Australian model. The issues around compliance today are really quite in review. So we know that the current system of detecting people who may be on the wrong side of the compliance discussion has moved from the Department of Human Services Medicare, DHS Medicare, into the hands of the Department of Health. And Health is now looking at a new way of how it will engage with professionals in the space and also in the scheme that they will use to investigate things when there is a problem. The current situation, as you know, is quite vexed and it's quite punitive. It's also more about making an example of people and not so much about remediation, seeing if people have made an honest mistake or don't understand and need some more education around the scheme that's actually held. The Professional Service Review Scheme comes into play quite later on in the piece when the Health Department feels that there is a concern that has not been addressed by review by the doctor in this case, and they sent it on to the Director of Professional Services Review. That process is very onerous. I've certainly helped people through that process over the years, and it's changed remarkably over the years. There was a time that there was a review into this process by the former Australian Federal Police Commissioner, Mick Palmer, and I helped him in that many years ago. I think things have gone a bit out of hand in the interim, and this whole process has become very much more about making an example out of people, a bit like the old hang, drawing and quartering of the medieval days, and not one about understanding what's going on and trying to remediate it. We also know that the system is not responsive to changes in medicine and changes in practice. Some of the expectations that are made are really difficult to follow. One major issue that I have with the whole system is the business of a peer review. The definition of what a peer is, what a peer review is supposed to be reviewing against. There is no tax ruling around some of the items that we are being held up against. The only adjudication is the wording in the Medicare Benefit Schedule, which is the only legislation that covers this. That says that a committee of peers makes the final decision about what they believe, the so-called peers believe, would be the view of the greater population of doctors involved in that same craft group. I think we need much more clarity about this. We need much more clear guidance. We need to make sure that we're doing absolutely everything to be the right side of the law. And if the law is a problem, then we need to see for that to be changed. I would say very much at the outcome, and I've said this in front of every health minister I've ever met, both Minister for Health and Minister for Human Services, that nowhere ever would I or any organisation that I've worked with condone people doing the wrong thing. People who are using Medicare inappropriately absolutely are not the sort of people we need to be supporting through the system. If this is a malicious or wanton way of exploiting Medicare, that's not something that is acceptable. Medicare needs to be looked after. It's the cornerstone of our healthcare system in Australia and gives people access to good healthcare that is affordable on the whole. This is not a discussion about Medicare rebates. This is not a discussion about the freezing of Medicare rebates. It's a question very much about there's a service, it's been done adequately and appropriately, it's met all the criteria required, and therefore people should have the opportunity to receive a rebate for their services, and the doctor doing the billing should not be in a place of fear or misunderstanding about what they are able to claim or not claim. If a doctor is working and sees the patient for the appropriate time, they should also be able to claim a rebate over and above the level B rebate, for instance. The issues today around chronic disease management are a major issue. We, in my practice, have gathered a group of practitioners around us to understand better what each practice is doing. What's interesting is these very highly performing practices in our area are all doing the same item numbers. They're all doing them differently. They've all got a different scheme. They all feel that they're doing it correctly and are compliant, but they're actually all very fearful because they don't know what they don't know, which is what their so-called peers would consider to be the right thing to do if they were actually asked to present to a committee of review. The notion, therefore, is that we need to understand from you who are gathered here where you've been affected by the Medicare scheme, by the Department of Health investigative processes, or indeed Medicare processes prior to that. If you have been investigated or under the process under PSR, it's important to know what that looks like so that we can understand where the systems are problematic. Again, I would emphasize this is not about trying to justify people who are not acting in accordance with the legislation or in accordance with the descriptors. But we do know, I certainly do know, and I've helped people in the situation, that the scheme is very unclear. If you actually followed through these claims that have been made about people potentially working inappropriately and followed them through the system, that system, when it comes to the committee of peers, is very open to variable interpretations from those peers that sit on that panel. And I think that we are very vulnerable, especially in this age where once you get on the train, through that process, it's very hard to get off the train. So I'm going to finish off there. Thank you very much for allowing me to say a few words to you. I think it's important to get a cohort of people and examples and ways where this is troubling, and we need to see if we can pull together a scheme, a way of operating, a way to make sure that people who are doing the right thing are not prosecuted inappropriately themselves, and that they are supported by organisations to make sure that they are doing the right thing and can be shown to be doing the right thing, and that's a clear outcome. Thank you very much. Goodbye.